Actually, in many of the specialty cares, the medical imaging, especially radiology, plays a very big role. So MR is a wonderful piece of technology. It's actually a golden standard for many critical cares like stroke, cancer, early diagnosis of cancer, or treatment of cancer. So, but it's very safe, and also you can actually do scanning any number of times. The problem is, India has very fewer machines compared to the population, 1 in 10,000, where it should have been like 1 in 1,000. The access to such a high-end technology is very limited to needy people, and that is something that actually I looked at it very beginning, where we want to make the medical imaging very accessible, and especially MR, which is actually very accessible. The problem with MR is that it takes time, so it takes like 30 minutes to 1 hour. So which means that we have limited time in a machine to do the number of scanning. And it's also very claustrophobic to patients, and they feel very uncomfortable to be inside. So I looked at the problem, and I found that what actually doesn't change the MR machine is the magnets and the coils. They're pretty stable, and you can use that for more than 15-20 years. But what changes is the software inside that. So we actually embarked on a journey building software not sitting inside the machine but outside the machine to do some kind of post-processing which will improve the quality. So this will actually effectively improve the quality of the scans. Like older machine quality can be as good as newer machine, and also actually reduce the scanning time, because we still run with the faster protocols. So that's something like reducing the scanning time. And the second is that the patients don't know whether they require scanning or not. Not often, right? We will be saddled with the question whether we want we have a headache and we want to actually get scanning done or not, right? And same way, we have many fearful incidences. We don't really know whether we should actually get into advanced analysis or diagnosis for the same purpose. So this can be actually important, where if we get the patient history and their symptoms, and also the doctor's prescription and everything, we can actually put them on a risk score, which actually can give an insight that that patient requires an MR scan or a CT scan or so. So we actually cut down the time for patient to actually get into the real needy, because if you actually delay any of these things, suppose if you are not going in a stage 1 cancer to do a scanning, and you want to go in stage 3 or 4, it's too late. So that kind of technology is what we have built. And once we do that, then again you have a lot of scans, and you will have very few radiologists. And there also AI becomes important transformation, where AI can actually detect help to these radiologists in terms of identifying, notating and quantifying things, so that it reduces radiologist time. So instead of they take about 30 minutes, it can be done in 5-10 minutes. So again, effectively, all these things put together can reduce the time by about 70%, and which means that patients can get quality care much earlier than what it happens now. When we were born, actually, we were just very few months old, and it so happened that you were actually solving the problem of reducing the scanning time for MR, but then COVID struck, and everything stopped, right? So now, of course, MR is the last thing that people do. So there were no diagnostic centers which are running an MR or anything like that. But that time, COVID, there were a lot of push towards technologies that can help. We know that RT-PCR and other technologies, vaccine was the main thing. But apart from that, they're also looking at, for example, X-ray based analysis, because in other countries like China and all, they started actually doing CT and X-ray based analysis for finding out something called ground glass opacity, which is an indicative of COVID symptoms. And so that made us initially to little bit deviate and work on the need of the day, where it is actually developing some technologies to address COVID. So during those days, we actually worked on a lot of COVID-related problems. So that also helped get some visibility to us, because we were one of the chosen for CCamp, and we developed technologies which actually we demonstrated during that time in many places. But then within 2 years, actually that is transformed. The problem was not that big, so we focus shifted to the thing that what we are set out to do it. But during the time also we understood that when people or everybody is working from home or everybody is at home, so these connected solutions are very, very important. So we started building the connected solutions because suddenly in second wave of COVID, there's so many teleradiology requirements. So it's actually it went exponentially up. So it's actually helped us also to build the right platform so that we can build it for long term, because at the end of the day, it's not just a AI algorithm, it's how you build it together along with the application that matters a lot. Yes, I mean it actually delayed our journey a few years, but it also taught us a lot in terms of building the right technologies and what is required for today's population. Data actually is very important in terms of first of all, in terms of keeping it not leaked out, right? So because we work on a lot of data, like patients' data, and this patient's data is very important to be not to actually leaked out. So the good thing here is that there are technologies, cloud technologies today, which are very safe and secure in terms of data security. First of all, it is transmitted using HDFS protocol, secure protocols, and it is encrypted at rest. So even if the data, if you are storing on a disk, it's encrypted. So you cannot really hack that, get that data and use it by itself. So in that way, I mean, the connected solutions today are actually very well evolved to protect the patient's data itself. And of course, when we have to actually go through certain certifications, even your quality management systems, and where we have to ensure that data security is implemented in very manner, right? So we went through those data security. We went through the VAPT certifications, where we ensure that even with the hacking, people cannot actually hack and get the data by itself. So it's all about implementing the right framework so that the data security is maintained. Having said that, and I would also want to bring it, data security should not be an hindrance, because that's a very well solved problem today. But what is not, people should not fear that, okay, my data is not secure, so I don't want to do it. Actually, this data is not secured mostly within the premises, because they're not built such a secured system by themselves. But if it is really put it a very secure system, it's very secure. And what is important is that that's data they can actually keep it for longer term, because a lot of times in healthcare, it requires the previous patient's history to know what is happening and and how the progression of disease is. It's very, very important that they keep that data in a secure manner for long term, and so that they can actually address the patient much more effectively. So basically, of course, I mean, there is a lot of data. In fact, we do see everybody holds data. Hospitals, diagnostic centers, all of them, healthcare, they hold data. But the important thing is that, first of all, they are not really properly kept in a good repository or something like that, and they are not annotated. They are not really actually meant for real good scientific studies. So for AI, it's very important that you get access to very quality data. And towards that, one thing is that there are good universities who actually built some good data sets, and they are very hard to get, because even, for example, Alzheimer's disease, it's not easy to get, but there are organizations who actually puts out that in the basically public domain, some of these data. So the university that people will have such good access to data actually, and they start just doing research on that. But then again, this is a very limited set of data, and then we want to actually get more amount data, because that is still good for initial publications, but it's not good for actually prioritizing very good technology. That is when they need to really work in real world use cases. So start building something where, when you want to actually build an AI, start building some real applications. So when you start building real applications, then you start accessing the data that is meant for that purpose, and then you can actually build better AI. So I would say that the purpose drives what kind of data that you want to get it. Basically, as a human beings, we are all motivated to do something better. We find definitely quite a bit of people. It's just that channelizing the energy towards the right things is very important. So when we actually talk to people, of course, we are being a startup. really cannot pay top dollars right at the beginning. So, but what we actually help to get people is to work on very interesting problems and get that actually motivation that if you are solving a problem, it's actually your work that is actually making a big difference, for the people. So, in fact, that's actually has help people to find some good people who are very interested in these things, who actually resonated well with our mission, saying that it is for the greater good and it's for the people, finding developing right technology. So mostly I would say that it is those good people who actually join us and really help us to build such technologies. And these people actually, you remember, see, these people are capable to get 2x or 3x salaries what they get here, but in spite of that they work with us, and it's actually, it becomes a much more kind of a mission, because when you have your own passion matched with your vision, so it becomes super effective. So that is what it is helped us. So all for we don't really need, especially this kind of technologies, we really don't need a lot of people. We just need to find 5 to 10 people who are very good at it and that actually resonates with your what you want to carry out things. So, and fortunately we will get people like that. Absolutely. I mean, one of the things that I see is that Gen Z is they always look out to do something differently, right? And in fact, they have good exposure right from the beginning. They know, like, what kind of technologies exist, what's happening today, what's happening in AI. They really know about what's happening around in general, and so they actually are interested to solve much higher order problems than we used to solve when we are very young. I think it's actually again giving the right problem to them, and making them involved more, and will actually really help. So what I see is that they are much more brave, and then us, because we are always in our times we are much more worried about our safety and all those things, and but here today they are risk taking, so they really want to go out and do something. Just that we just need to help them to get things perfected, because there is no instant gratification in any of these things what we do, especially in science. It takes time. It really takes time, a lot of effort, and knowledge to bring out that things. So just that we need to inculcate that discipline among the Gen Z. If it is done, and then that's it. I mean, you probably have a real winner here. The initial medical manufacturing is revolving around more actually assembling and building some components for it, but there is still a lot more to be done, because when we talk about core components, it lot more things can be actually built in India. So I would say there is an opportunity to build an entire supply chain for medical device here in India, be it smaller components, and also that is the first big opportunity I am seeing it. And for AI also, government is actually promoting. For example, CDAC provides AI infrastructure, and they provide like about 200 hours of infrastructure for people to train data, right? So, suppose if you want to develop your own model in AI, you need those advanced GPUs where you can train them with. So that is possible today because you have access to some of those GPUs as well, which the government is subsidizing and providing you. So this is very, very important, because all this ecosystem play, we can participate in it. And either you want to build a devices, or you want to build your own actually AI models, or you want to build an expertise where you can actually work together cross-domain, both be it in clinical and technology together. So all that is possible today because of the government encouragement. I would say that I assume like in 5 years today, what is pathology, it will become like for in radiology. So basically in pathology, if today you want to do a blood test, and somebody will come to your home, take the blood and then do the testing and give the report, all those things, right? So it's such a seamless thing. It's almost reach to everywhere. And same thing would happen if you want to actually do the scanning. It's much easier to just time where you give an appointment, and then it will be in somewhere near your home, and just do the scanning immediately. It is very fast scan and very convenient process. And there are actually technologies which are actually coming in picture, which actually has much more open. Today the magnetic doors create a claustrophobic effect to people, so they're quite open, and those kind of technologies are there. In fact, I would always compare this with how actually when I was in my first job in Motorola, we were developing the video recording. Uh, we were very poor quality video recording that we used to develop in the very early days. But today you see that people can actually capture images, photos, videos, whatever, from their phone, and very high quality, even using their specialized cameras. So once it actually becomes so easy, the process, it makes it really useful, right? So my another analogy that I used to say is that uh, take a look at how for example, you go for a security check in airport. How it is streamlined. Okay, you want to go, especially there are 360-degree checks, X-ray checks, and where you can see any metal object inside your body or anything. So that will be done in a jiffy. So you just need to go to a chamber, they just do a 360-degree rotation, and then you're out of that. So that's like kind of a very simple process where everybody can do it. Now imagine that you do that, once in 6 months, like that kind of process, but you will come to know any of the elements. For example, there is a small tumor which is really seen otherwise, so very early, stage 1 or stage 2, right? And or some neurological disorder things which probably will find out early, or your spinal disorder things, which you want to find it early. So all this, it happens very fast. So imagine that will actually bring kind of a amount of information where you don't need to suffer, because some of these problems become worse later, right? So you take that care of that much earlier. So this is kind of things what I imagine radiology, where the information, the picture speaks 1,000 words. So this kind of scans are available to people to make the inference themselves, and also to adopt their lifestyle for better. So there is no dearth of problems to solve in healthcare. But it's also very important that you put up a problem where not it's not that there are quite a few people who are solving now, because sometimes what happens is that people they talk about things when it's quite mature, but that's not the time when you want to enter into a technology. You want to enter into a technology which is quite nascent. So the better way to do that is to actually see what are the problems that are still there, well unaddressed, and if you extrapolate the kind of computing that goes tomorrow, and the kind of advancements in algorithms, technologies that goes tomorrow, one of the problems that you cannot solve today but can actually solve much better way tomorrow, right? So that is what I think I would advise people to look at it, because if you start today, maybe in 5 years it becomes a mainstream thing. Always consult with the experts who are actually worked in this field for long, and they know that what problems they may have solutions, what problems they don't really have solutions, are looking for it. But not all the problems are really very well implementable. So you also have to know the limitation in technology and the right time to implement that. So it took me even for me also, I actually jumped into healthcare about 5 years ago. It took me 2 to 3 years to really understand the problems that are being actually need to be addressed here. Okay, and now I can speak much more in detail what problems need to be solved for people for the next generation. Like that, I think it's good to consult with people who can actually guide you on the problems to be solved for next.